Hi, I'm Dr. Brian Thornburg, and a mom asked a really good question. Her child is 2 years old. He's had 4 ear infections in the past 12 months, and the pediatrician and ENT are recommending tubes. Mom's anxious about putting her child under anesthesia for the tubes. She also doesn't like the idea of instrumentizing the child's tympanic membranes or eardrums and is asking if there is a solution other than having surgery. This person is not a patient of mine. They posted this question to me through direct messaging on Instagram. There are some solutions that I would look at before I went for tubes. Tubes, to me, any surgery procedure, if it's not life-threatening, is always a last resort option, in my opinion. Having no knowledge of this child's previous history, I'll just walk through what I would do in my practice. So if a child came in, frequent ear infections, requiring antibiotics, 4 in 1 year, first we would look at environmental controls. We want to make sure that we were controlling as much as we could in the child's bedroom. Half of their life is spent sleeping, so we want to make sure that we have a good grasp that it is a clean environment. So we're going to remove all stuffed animals off of the bed. We're going to put allergy covers over the mattress and the pillows. It's important that this is an allergy cover. You can buy that on Amazon. Then we put a HEPA filter or some type of high quality air filter in the room and leave that running all of the time. The comforter has to be super hot washed every week to remove any of the dead skin cells because that feeds the dust mites. And 25% of your pillow or of your mattress is actually dust mites. That's how populated and ubiquitous dust mites are in our bedroom. So all of this is designed to clean the bedroom as much as we can. And this will take some time for the child to have a response to this and decreased allergy symptoms. If his or her issue is dust mites or something in the bedroom, like cat or dander or dog dander or something like that, feather, cockroach, if that doesn't solve the problem, then we look at food because food can be a trigger to allergies and congestion in the middle part of the ear. Very few people know this, but the middle part of the ear and our GI tract are derived from the same embryological tissue. If there's an allergy to a food, and we know kids have lots of allergies to food at these younger ages, there can be a similar inflammation up into the middle part of the ear. So that's why we see so many ear infections in these younger kids, partly because of the same embryological tissue between the two areas. So the 5 most common foods resulting in allergic-like symptoms are going to be egg, gluten, dairy, soy, peanuts. Those are the 5 most common foods. So you have to eliminate all 5 of those foods, 100% elimination for 2 to 3 weeks. 100%. You don't want to cheat. So it is a dedicated 2 to 3 weeks on removal of those 5 foods and then also seeing where the benefit is. The next step, if we have no benefit from environmental controls in the bedroom, if we don't have a benefit from food elimination, then I will look at Zyrtec and I will do Zyrtec at a high dose. So I'm going to give even a 2-year-old, even a 1-year-old, I'll give them 10 milligrams twice a day. So that's 20 milligrams total a day. We'll do that for 3 or 4 days. That dose, if there is some other kind of allergic issue outside of the bedroom, then this dose will handle it. If we find that there is a benefit to the Zyrtec, then I will switch them on to quercetin. Quercetin is a plant-based mast cell stabilizer, widely used throughout Europe. It is not a pharmaceutical, but you do want to buy a high-quality pharmaceutical-grade quercetin product, but it is not from a pharmaceutical company. It does not work immediately like Zyrtec. So Zyrtec is an antihistamine, which means if you come into contact with cat and you have an allergy to cat, and that will make some mucus because that cat hair will connect with the mast cells, and the mast cell then will degranulate and release histamine into the tissue area, and then that causes swelling, which makes us feel congested, or it causes a hive or our throat to close. So Zyrtec comes along and cleans up the histamine, so then that takes away the swelling that's happening, so we become less congested or the hive goes away. Quercetin is a mast cell stabilizer, so it works over time. It's like your heart medicine. If you had an arrhythmia, you're not going to take your calcium channel blocker, your beta blocker. The moment you're having a heart attack, you're going to take that every day to avoid your heart attack. The same with quercetin. You take quercetin every day to stabilize the mast cells. So if that cat comes into your body and it attaches to the mast cell is less likely to degranulate and release the histamine. So then you have less of an allergic response, and quercetin's natural. So that's the next step that I look at. Now, if we've gone through all of these steps and we're not controlling the frequency of the congestion that's happening in the ear and the ear infection, and we know the child is eating a healthy diet, and if it's of age is eating an organic formula or eating organic foods, and the parents are giving supplement because I'm a big believer in supplements. Most of the adult population is deficient in key vitamins and minerals. And if children are eating like the parents, then chances are they are deficient in key vitamins and minerals as well. And when I say most adults, 70 to 90% say for vitamin D deficiency in the adult population. So I think it's very clear that children can benefit from the support of supplements. So if we're doing all of these steps and the child is still having an ear infection, that's when I would resort to tubes. Thank you.